Hello, everyone. Welcome to our Blunt Basics, Basic TCM, or TCM 101. Let's start the ball rolling with the first presentation. Superficial energy circulation. An exterior meridian flows between the skin and muscle, and it has points of its own, flows on the ventral, medial, or the lateral dorsal sides of the arms and legs. These are the yin-yang surfaces of the limbs. In the evolutionary process, humans first stood on all fours before standing erect. The parts of the body and limbs that were in contact with the sun, wind, and rain were called the protecting surfaces, called the yang surfaces. The part of body and limbs that was not exposed is said to be the protected surface or the yin surface. Even as we stand erect now, these areas are still considered to be our yin and yang surfaces. The body hair distribution and the temperature in these two areas is different from each other. Imagine we have two adjoining rooms. One is a cold room where meat is refrigerated. The other is an oven where bread is baked. Now, imagine there is a water pipe that runs through the walls of both rooms, with water flowing from one room to the other. The water, when flowing through the cold room, would be cold, but the same water would heat up when flowing through the heated room. The only difference being that the outside temperature will have changed. Energy changes polarity from yang to yin in the exterior meridians. If it flows from a yin meridian to a yang meridian, or vice versa. So take note of that. There is always a change in polarity when there is a transfer of energy flow from yin to yang meridian or from yang meridian to yin. The environment is more important than the energy in the superficial energy circulation. We will now work with one superficial energy circulation of the body. So we have the coupled meridians, the exterior relationship. Example, lung yin deficiency and yang excess. Symptoms, thin and dry skin with redness and inflammation. Because of their interior relationship, coupled organs have the same picture of imbalance. So we could say that in 95% of the time, the large intestine will have the same imbalance. In the exterior, yin and yang meridians flow in the ventral, medial, and dorsal lateral sides of the limbs. The climate in these two surfaces is very different, like cool and hot rooms. When energy flows from one to the other, as we mentioned earlier, it changes polarity. So let's define some points. A yuan source point is the point where the energy flows out of a meridian into the coupled meridian. So example is the lung energy, the lung channel. If there is a point in the lung channel, this is called the yuan source point. If it will flow out of the lung channel into its coupled channel, which is called the large intestine channel. A luo connecting point is the point where energy flows in the coupled meridian. So this is the point where energy flows in the coupled meridian. And it is always the point of entry. So the luo connecting point is always the point of entry. So yuan point 4 to luo point 7, because we consider the luo point as the entry point, while the yuan source point is the point where the energy flows out of a meridian. going into the coupled meridian. Okay, so then for the lung meridian, we have the yuan point lung 9, which will flow out into the luo point in large intestine 6. Okay, so again, Li4, yuan point of the large intestine. This will flow out into the lung meridian, specifically the entry point, which is the luo connecting point. So in this case, it's lung 7. Now, the yuan source point of the lung meridian, which is lung 9, this will flow out into its coupled channel or meridian, which is called the large intestine, via the luo connecting point lung 6, large intestine 6, sorry. In order to balance this, we need to use the collateral on the left to send energy from the large intestine to the lung. So sedate Li4, which is the yuan source point. So this will sedate the large intestine yang directly, and it will sedate the lung yang indirectly. Tonify lung 7, luo connecting point. This tonifies the lung yin directly and the large intestine indirectly. Energy will flow from the large intestine, which is decreasing large intestine yang, into the lung, which is now an increasing lung yin. Okay, so yuan source points have connections with other meridians. This must not be confused with their relationship with the coupled meridian. Okay, so lung yin is decreased. That means the yin meridian has 2 less yin. Large intestine yang is increased. The yang meridian has excess yang. So when the large intestine yang decreases, the lung yang would flow through the interior energy flow into the large intestine, thus reducing the lung yang as well. Now that lung yin is increased, it would flow, because it's increased, it will have to flow into the deficient yin of the large intestine to increase the Li yin as well. So the new balance state is now shown in the tower diagram. So we have the lung plus Li in balance. Thank you very much for listening. Hope you learned something from that. We will now proceed to the second topic. Let's call on Ma'am Teresita Sumile for the presentation. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Let's continue our study on miscellaneous pathogenic factors. Okay, now let's talk about blocks on meridians. We often see patients with pain around surgical scars. The worst form of this is phantom pain, but the authors see many patients who have symptoms not actually related to the area of the scars. Now, let's take an example. On this case, a female, 59 years old. The patient was a 59-year-old woman with low back pain for 12 years duration. The pain was across the low back on both sides, but the left side was worse, and she had sciatica down to the left UB meridian when she stood for over 15 minutes. There was no tingling down the leg. The author treated her with local points along the sciatica with electrical stimulation to relieve the yang dominant pain. She felt slight improvement, but still needed painkillers at work. It became clear to me, to the acupuncturist, that hers was a chronic yang dominant pain on the UB meridian, and that he should tonify the yin of the urinary bladder and kidneys. When he was about to tonify the kidney meridian, he noticed in her history that she has had a hysterectomy 14 years ago because of uterus fibroids and excessive menstrual bleeding. The scar was over the pubic symphysis, cutting through the ren and kidney meridians. He unblocked this scar and reconnected these three lines so that they could flow through again. He did not. He did this at the same treatment session when he treated the back pain. Her backache quickly started to improve, and the sciatica disappeared after the first treatment session. Okay, so as illustrated, so there is a block here on the scar. Then the acupuncturist used 6 needles, 2 per line, to unblock the scar. Okay. Any symptom of the or disease that appears later on in one's life is possibly caused by a block in the energy flow, which could be caused by a surgical scar, a tumor, or other causes. He know of patients who had symptoms of asthma, which disappeared after connecting a skin cyst at the radial artery, headaches that were cured after unblocking abdominal scars. It is a very simple treatment given twice weekly, about 8 times in all. Once the meridians are unblocked and the energy has passed through, the symptoms improve from the first treatment onwards. Okay, yun lang po. Thank you so much for your attention.
Thank you very much, Ma'am Teresita. We now proceed to needling techniques. Part 3. Holding the needle. The acupuncture needle should be held lovingly with at least 3 fingers. The index and the middle fingers are placed on the handle and needle shaft, respectively, and the thumb is placed in the middle, thus touching both the fingers, the shaft, and the handle. This gives stability to the needle, and on using the wrist, one can turn the needle to any side for insertion. An acupuncture point has a diameter of 1 millimeter to 3 centimeters. During winter and in yin diseases, the energy of the meridians tends to descend deep into the bone, thus making the points smaller and more difficult to reach accurately. In summer, and when patients suffer from yang dominant diseases, the energy rises to the surface and the points become larger, and it becomes easy to get to the point with a needle. Needle sensation. A therapist should try to produce needle sensation around the needle so that the point is within this energy field. This needle sensation can be one of the following: dull ache around the point, conduction along a line, often the meridian line, pins and needles, heaviness of the limb or this area, a tension in this area. When the patient experiences any of these sensations, it is a sign that energy has arrived in this area and is at our disposal to tonify or sedate it, ascend or descend it, activate or calm it. The sensation is called Da Qi, and it is the acupuncturist's best friend. Most needles are given with even method, which means the needle is manipulated until a needle sensation is obtained. Then it is left in position for 20 minutes, and finally, it is removed. However, some needles are used with specific needle techniques to give special messages to the meridians. Let's talk about tonification and sedation. Tonification needling technique. After inserting the needle, mild manipulation is done. So this means small degree of lifting, thrusting, twisting, and twirling to produce needle sensation. In sedation needling technique, after inserting the needle, strong manipulation is done. Large degree of lifting, thrusting, twisting, and twirling to produce needle sensation. Needle direction for tonification in the direction of meridian flow, twirling with thumb first towards the center, then away. So this is the center of the body or the midline. For sedation, needle direction is against the direction of meridian flow, twirling thumb first away from the center, then towards the center. For tonification, there is quick thrust and slow lifting. With sedation technique, there is quick lifting and slow thrust. Tonification, the handle is scraped along the body. In sedation, the handle is scraped away from the body. Tonification, the needle is retained for 20 to 60 minutes, longer in elderly patients and in chronic disease, while in sedation, the needle is retained for only 5 to 30 minutes, shorter in acute states. In tonification, the needle is removed during inhalation. In sedation, the needle is removed during exhalation. Tonification, the needle hole is closed, while in sedation, the needle hole is left open. In tonification, moxibustion is used for tonification of the yang. This is used in cold diseases of local areas or on front mu or back shu points in organ diseases. In sedation, bloodletting is used as elimination of heat and to release blood stagnation. To release heat, this method is used on Jingwell points. These are end or start points of meridians on the fingers or toes, or back shu points, or areas of venous bleeding, and sometimes on local muscle pain areas. In tonification, acupuncture or point injection therapy is used to prolong and increase point stimulation. It therefore increases energy. This is used in chronic conditions where there are severe deficiencies. In sedation needling technique, vibration technique is used for constant agitation of the needle and is an excellent method for dispersing energy. Not all tonification or sedation techniques are used on a point. Usually, one or two methods are selected at one time. Tonifying a point merely means that we bring blood and energy to this area from other parts of the body. Sedating means that we disperse blood and energy from one area to other parts of the body. Needling is one way of doing this. Through our selection of points, we can give the body direct messages about where we will take the energy from or where will we send it. Not every needle we put in a patient will tonify or sedate the energy. And many times we treat local, distal, symptomatic, and influential points with a balanced or neutral needle technique. There are many other needling techniques which combine these maneuvers in different ways to achieve different results. For instance, if a patient suffers from upper respiratory tract infection with irritation of nose and throat, blocked nose, sneezing, headache, this is called exterior wind symptom. It is caused by wind exposure and wind attacks in the exterior parts of the body. The skin and muscle and the area between the head down to the throat. If the bones are affected or if the voice changes, it means that the exterior pathogenic factor has moved to the interior. This exogenous pathogenic wind can be eliminated from the exterior using wind elimination points and a wind elimination needle technique. The wind elimination technique used varies depending on the hot or cold nature of the wind symptoms. Thank you very much for listening. We now listen to Ma'am Teresita Sumile for the next presentation. Good afternoon ulit, Ma'am Teresita.
Yes, Doc. Good afternoon ulit at sa lahat na po. Earth element, the concept. Third day na po tayo. Spleen absorbs and distributes nutrients. The spleen absorbs what the stomach digests and sends the nutrients downward to the kidneys. The kidney makes bone marrow, which makes blood, and sends the blood up to lung in the upper warmer. The lung introduces oxygen into the making of blood, and finally, heart synthesizes red blood, combining all these nutritional factors. The red blood, once synthesized, will be circulated centrally by the heart chi to all the organs and tissues, and peripherally by the spleen chi. Absorption of nutrition is a function of the spleen. If the spleen function is deficient, there is malabsorption. So diabetes mellitus, where glucose absorption is affected, malabsorption, diarrhea after meals, or vomiting after meals are all examples of this. A patient with spleen chi deficiency has difficulty absorbing nutrients from the food he or she consumes and could therefore be malnourished. This is called spleen blood deficiency, meaning there is less stored nutrition in the blood. This is called spleen blood deficiency, meaning there is less stored nutrition in the blood due to spleen malfunction or because the patient eats poorly. It is important to tonify their spleen chi and advise them to eat foods that are easy to digest and absorb in their condition. Okay? In diabetes mellitus, both types 1 and 2, the patient should be advised to avoid refined carbohydrates and sugars and eat whole meal, that is unrefined products. In cases of malabsorption diarrhea, heavy and fatty foods should be avoided. All food must be cooked and eaten warm and in small portions, but more frequently. Spleen circulates blood in the periphery and is responsible for the capillary circulation of blood. It is possible to be warm in the body and have cold extremities when the spleen yang is deficient. Because of the blood does not reach the hands and feet, it has to be all extremities, which are hands, feet, nose, and ears, just one of them. There could be numbness or even poor healing of wounds. Reynolds syndrome and polyneuritis, common in diabetic or alcoholic patients, are some examples. Also, since the capillary circulation is affected, the blood and fluids stagnate here. The capillaries could be injured easily, thus causing bruising or slow bleeding symptoms such as easy bruising, spotting at the end of or between cycles of menstruation, bleeding gums, and microscopic bleeding in urine stools. Thank you so much for listening.
Okay, Ma'am Teresita will continue with the next presentation.
Good afternoon ulit, my dear classmates and Doc Heck. Let's continue our study on the 8 principles. Third day na po tayo. And now let's talk about heat and cold. We have here syndrome for full cold or yang deficiency and full heat or yin deficiency. So signs and symptoms of full cold, we have aversion to cold, cold limbs, chills, no thirst or desire for warm drinks, pale, loose stools, clear urine, fatigue, lethargic, clear watery, and profuse discharge. Tongue is pale, moist, with white coat, and the pulse is slow or tight. At dito naman sa full heat or yin deficiency, signs and symptoms are no aversion to cold, hot, dry limbs, fever, thirst for cold drinks, red face and eyes, constipation, dark scanty urine, irritability, yellow thick discharge. And then the tongue is red with yellow dry coat. The pulse is rapid or full. Now let's go to relationship between cold and heat. Complicated symptoms of cold and heat. Cold and heat, signs and symptoms at the same time. So we have here heat above with cold below, or cold above with heat below. Then exterior cold with interior heat syndrome. That is chronic interior heat gets exterior cold. Then exterior heat with interior cold syndrome. It is chronic interior cold gets exterior heat when it is over time. Okay. And then transformation of cold and heat. It is a consuming of one another. So we have cold syndrome changing into heat syndrome. Example is exterior cold when it is prolonged, it turns into heat. Then heat syndrome changing into cold syndrome. That is exterior heat when prolonged, it turns into cold. Then true heat interior with false cold in the exterior. So in excess, interior heat which hinders the yang qi from reaching the exterior. So true cold interior which with false heat exterior. So excess yin cold interior which forces yang qi to exterior. Okay, now true and false. Next part. True and false phenomenon in heat and cold syndromes. We have here syndromes of true heat with false cold and true cold with false heat. Signs and symptoms of true heat with false cold are thirst with preference for cold drinks, no covers when lying down, dark complexion, no swelling, red, hot skin, cold limbs but anterior side of the body is hot, dry or severe hot diarrhea, and then dark scanty urine. The tongue is deep red with dry yellow coat, and the pulse is deep, thin, and forceful. Dito naman sa true cold with false heat, signs and symptoms are thirst with preference for cold warm drinks, covers up when lying down, red complexion, there is swelling, then the skin has normal color and temperature, it's also normal. Then limbs hot, anterior side of body is normal temperature. Uh, Limbs are hot, but anterior side of the body is normal in temperature. And then loose stools and clear urine. Tongue is pale, moist with white coat, and then the pulse is large but weak. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We continue with Zangfu organs. This time we discuss lung pathology, or we continue discussing lung pathology. Stagnation of lung qi. Stagnation of lung qi impairs the descending of qi, or downbearing of the qi. And so what happens is qi accumulates in the thorax. Cardinal symptoms: repressed sorrow. The patient would feel some constriction in the thorax, existential fears, shortness of breath. Dryness in the lungs. Dryness in the lungs is the initial stage of lung yin deficiency. Cardinal symptoms: dry cough, dry throat, itching in the throat. There is dry cough because the lungs are not moistened sufficiently. The voice is hoarse because the lungs do not moisten the throat sufficiently. The throat is dry because, again, the lungs don't moisten the throat sufficiently. Dry mouth, throat, and nose is due to the fact that there is impairment of the lungs' moistening function. Skin is dry because of impairment of lungs' moistening function. Wind cold in the lungs. In wind cold in the lungs, the defensive qi or wei qi of the lungs is fighting against the invasion of wind and cold pathogenic factors. Cardinal symptoms: acute cough with watery or white sputum, aversion to wind and cold, sneezing, feeling chilly, shivering. Wind heat in the lungs. In wind heat in the lungs, the defensive qi or wei qi is fighting against the invasion of wind and heat pathogenic factors. So wind heat in the lungs can be a reaction to wind cold in the lungs. Cardinal symptoms: acute cough with yellow sputum, aversion to wind and heat, infection with fever, sore throat. Phlegm, cold in the lungs. In phlegm, cold in the lungs, dampness or phlegm and cold have invaded the lungs. It corresponds to excess pattern involving the spleen. Spleen is always involved in the development of dampness. Cardinal symptoms: cough with white viscous sputum, feeling of constriction in the thorax, aversion to cold, face edema with cold sensation, white tongue coating, sinusitis with white secretion. Phlegm heat in the lungs. Dampness and heat have invaded the lungs and are condensed into phlegm. This corresponds to an excess pattern involving the spleen. Spleen is always involved in dampness. Cardinal symptoms: cough with yellow viscous sputum, feeling of constriction in the thorax, aversion to heat, face edema with heat sensation, yellow tongue coating, sinusitis with yellow secretion. Thank you very much for your attention. Let's now call on Ma'am Needs You for Meridian Theory. Good afternoon, Ma'am Needs. Certified
Good
acupuncturist
afternoon.
from Silang.
Okay. Thank you, Doc Hector. Good afternoon, everyone. So the topic for today in our 28th day is meridian theory. Okay, urinary bladder meridian of foot great yang, part 4. UB28 and UB32 location. UB28 1.5 lateral to the posterior midline on the level of the second sacral foramen. UB32 is located on the fourth sacral foramen on the level of the superior end of the prima ani, sometimes a bit more superiorly or inferiorly. Place the little finger on the fourth foramen, then the ring, middle, and index fingers on a slightly V-shaped line in a superior direction, palpating for the depressions of the sacral foramina. With the fingers on this position, the middle finger would be on the second sacral foramen or the UB32, urinary bladder 32. Okay? Palpate po natin. Okay. Ang explanation po ng point, these 2 points are often used in problems of irritable bladder or difficult urination in prostate hypertrophy. The points are very close to each other at the height between the second and third sacral vertebra. The point UB32 should be needled into the sacral foramen for effect, okay? UB32 is used for painless childbirth with electrical stimulation or TENS. Yung TENS, ibig sabihin transcutaneous electrical nerve stimulation. UB28 is the backshoe points of the urinary bladder. Tingnan po natin sa drawing, okay? Let's go to UB37 or urinary bladder 37. Location, 6 distal to UB36 or the gluteal crease on a line connecting UB36 and UB40 in the popliteal crease in a gap in the musculature. So may muscle po. Point explanation, a meridian distal point. This is used mainly in low backache. It is also used as a local point in sciatica. A very deep point which should be needled 4 to 5 centimeter perpendicularly to be of effect. Okay? Let's go to UB39. Location at the lateral end of the popliteal crease on the medial side of the tendon of the long head of the biceps femoris muscle. Okay? Point explanation, the lower C point of triple warmer. This is often used against edema anywhere in the body and is excellent against Baker's cyst. UB39. Nasa drawing po. UB40 naman, ang location is in the center of the popliteal crease between the tendons of the biceps femoris and semitendinosus muscle. Okay? Point explanation, the area distal point for the entire back. This is used in backache very successfully, but it is also the earth point of the urinary bladder and increases dampness in the meridian. So, see controlling cycle po. Okay. I would not use it if there is a yin pain, such as when starting to move from rest with a lot of stiffness. I would prefer point UB37 in this situation. Okay, magandang point po yan. UB40. Next, UB54. Location, 3 tune lateral to the posterior midline on the level of the fourth sacral foramen, approximately at the center of the buttock. Sa may dito sa puwet. Point explanation, on the second parallel line to the do channel, this is the best local point to be used in sacroiliac joint problems and in osteoarthritis of the hip joint together with the point GB30 or gallbladder 30. Okay? Tingnan po natin yung drawing. Let's go to UB58 naman. Location. 1 tune distal and 1 tune lateral to UB57 or centune proximal to UB60 at the posterior border of the fibula and at the lower border of the gastrocnemius muscle. Point explanation, the loop connecting point of the meridian, it is best used in situations of stagnation of dampness in the organs or meridians, stiffness and pain of the back when beginning a movement from rest, fibroids, hypertrophy of the prostate gland, Baker's cyst, and rest urine in the urinary bladder. This 1 point can balance the yin stagnation, UB58. Okay? Thank you for your attention, everyone. Thank you, Doc.
Thank you very much, Ma'am Needs. We now go to our last topic for today. We are still on chest painful obstruction syndrome. This time we talk about the channels. The most important channels in the pathology of chest painful obstruction syndrome are lung, pericardium, and great connecting channel of the stomach. When the chest painful obstruction syndrome manifests with chest pain, both the heart and the pericardium channels are involved, especially the pericardium. So here you could see the illustration of the lung channel, the pericardium channel, and the great luo of the stomach. While as an organ, the pericardium is the outer covering of the heart, and its functions are similar to those of the heart, from the point of view of the channels, the pericardium channel is quite distinct from the heart channel. On a physical level, it has a different sphere of action, influencing the area at the center of the thorax. The Yellow Emperor's Classic often refers to the pericardium as center of the thorax. Pericardium channel goes to the center of the thorax, and this area called Shanchong is under the influence of the pericardium. Chapter 35 of the Spiritual Axis says, center of the thorax is the palace of the pericardium, Shin Chu. Hence, the important action of pericardium 6 on the chest and of the point Ren 17 to affect the pericardium channel. Being in the center of the chest, pericardium influences the gathering qi or zong qi, therefore both heart and lungs. Pericardium in this area acts as agent of propulsion for the qi and blood of both heart and lungs. For this reason, pericardium patterns are characterized by clinical manifestations along chest channels. So there will be tightness, stuffiness, distension, oppression, or pain of the chest. While in terms of organ functions, the pericardium is obviously closely related to the heart, it is exteriorly interiorly related to the triple burner channel, the pericardium being yin and the triple burner yang. For all these reasons, pericardium channel is involved in pathology of chest painful obstruction syndrome and must be used for treatment. That is why Ren 17 and bladder 14, both affecting the pericardium, are important points for chest painful obstruction syndrome. So if there is distending pain, there is qi stagnation. Feeling of oppression or tightness of the chest, phlegm. Burning pain, there is heat, usually phlegm heat. Very severe pain, retention of cold in blood vessels. Stabbing pain that is fixed, feels like a knife blade, blood stasis. Yang deficiency should be differentiated from retention of internal cold. So retention of cold, exposure to cold aggravates it. Patient has no aversion to cold and limbs feel cold to touch. In yang deficiency, patient has aversion to cold, likes to curl up and cover up, feels cold, face is pale, limbs feel cold to the touch. So, in summary, the organs involved in chest painful obstruction syndrome are the lungs, stomach, liver, spleen, and kidneys. Pathogenic factors, blood stasis, phlegm, cold, retention of food in the stomach also affects development of chest painful obstruction. Chest painful obstruction is always characterized by combination of deficiency and excess. Root of the disease is deficiency of spleen, heart, or kidneys, or a combination of this. The manifestation is characterized mostly by stasis of blood, cold, or phlegm. The symptomatology of chest painful obstruction is characterized by obstruction of blood vessels, which leads to pain. And we have discussed this earlier. So again, the most important channels are lung, pericardium, and great connecting channel of the stomach. The great connecting channel of the stomach emerges from the stomach and goes to the area below the left breast. Pulsation that can be felt here, called Shuli, is the pulsation of the great connecting channel of the stomach. Thank you very much, everyone, for joining. We hope to see you in our next presentation. Thank you.